With so much talk about cognitive decline in the news these days, you may be concerned about your risk for dementia or it happening to a family member, friend, or coworker. In this video, I will tell you the root cause of dementia, what you need to do to reverse it, and some additional resources you will need to know about at the very end of the video. So make sure to watch the entire video. If you are new to my channel, hi, I'm Dr. Hampton, a board-certified family and obesity medicine doctor with over 29 years of clinical experience. And my goal is to help you and your family achieve metabolic health. So if dementia is a diagnosis that scares you and you want to make sure that nobody that you love gets it, let's talk about it. Let's start by explaining why the thumbnail in this video mentions type 3 diabetes. I mean, what does dementia have to do with diabetes anyway, right? Well, it's pretty straightforward. Some experts use this term to highlight the relationship between diabetes and your brain health. Studies have shown that individuals with diabetes are more likely to develop cognitive impairment and dementia later in life. The question is why? It's because research suggests that insulin resistance that leads to diabetes can contribute to the development of Alzheimer's disease and other forms of dementia. Insulin is critical for regulating blood sugar levels in the body and plays a role in brain function as well. So when insulin resistance occurs, it can affect the brain's ability to use glucose for energy, leading to what's essentially a brain fuel storage crisis. And when we don't provide adequate fuel for the brain, this can lead to brain shrinkage, which is why doctors like myself order CT scans or MRIs of the brain for this condition. And cognitive decline, which is why we refer patients to doctors called neuropsychologists to evaluate how well the brain is working. Furthermore, diabetes can also cause inflammation and oxidative stress in the brain, which are both factors associated with the development of dementia. It is important to note that not everyone with dementia will get diabetes, and not everyone with diabetes will get dementia. However, understanding the link between these two conditions can help individuals take proactive steps to reverse their type 2 diabetes and reduce their risk of developing cognitive impairment later in life. At the end of the video, I'll tell you exactly what you need to do to make sure you don't have to deal with this. Now let's delve into the topic of why dementia is considered a metabolic disease. Dementia is a syndrome characterized by a decline in cognitive function, which can negatively affect your memory, how you think, orientation, comprehensions, how you calculate things, learning capacity, your language, judgment, and many other symptoms, a long list actually. While traditionally seen as a neurological condition, research has increasingly shown that dementia is also linked to metabolic dysregulation. In order to understand this better, the difference between metabolism and metabolic rate needs to be explained. So metabolic rate is the amount of energy your body uses to maintain bodily processes, while metabolism is the set of chemical reactions that occur in the cells of living organisms to maintain life. For purposes of this discussion, it's more about metabolism, which involves the breakdown of nutrients to produce energy, as well as the synthesis of molecules necessary for our cells to function properly. In the case of dementia, certain metabolic processes within the brain are impaired, leading to cellular dysfunction and ultimately cognitive decline. And as previously mentioned, it is the insulin resistance that is a key player in this metabolic dysfunction. Now that I've mentioned insulin resistance, or insulin again, let me explain more about insulin. Insulin is a hormone that regulates glucose metabolism, signaling cells to take up glucose from the bloodstream. In individuals with insulin resistance, cells become less responsive to insulin, leading to elevated levels of glucose in the blood. This chronic hyperglycemia can damage blood vessels and lead to inflammation, both of which are associated with increased risk of developing dementia. Additionally, disturbances in lipid metabolism have been linked to dementia. So high levels of some of your cholesterol components, especially but not limited to your triglycerides, can lead to the formation of plaques in the brain, which are characteristic of neurodegenerative diseases such as Alzheimer's. These plaques disrupt neuronal communication, contributing to the cognitive symptoms seen in dementia. By identifying and targeting metabolic pathways that are dysregulated in dementia, preventive strategies for this debilitating condition can be used to prevent and reverse it. Now here's the good news, guys. Reducing chronic insulin elevation can help reverse dementia and the risk for getting dementia. And when we consistently consume sugar, excessive carbs, and grains, our insulin levels can become elevated over time, culminating in insulin resistance. However, the good news is that there are steps we can take to reduce chronic insulin elevation and potentially reverse dementia and the risk of ever getting it. So one of the most effective ways is through dietary changes, as you could imagine. By reducing our intake of sugar, excessive carbs, and grains, and increasing our consumption of animal protein and, of course, non-starchy vegetables, we can help reduce our blood sugar levels, resulting in less insulin production. In addition to dietary changes, regular physical activity has been shown to improve how well insulin works in our body, improving insulin sensitivity, which will allow it to work better and reduce the need of the pancreas overproducing insulin in the first place. Now, when it comes to exercise helps the body utilize glucose more effectively, which can help prevent insulin resistance and protect the brain from the damaging effects of high insulin levels. So by reducing chronic insulin elevation through dietary changes and doing regular but not excessive exercise, we can both reverse early dementia and reduce the risk of getting dementia in the first place. Finally, as promised, here are some valuable tips on how to start healing from dementia. One of the first tips is to be in ketosis by adopting a keto or carnivore diet. These diets are high in healthy fats and low in carbohydrates, which can help improve cognitive function and support brain health. The brain loves using ketones as a primary fuel source because ketones are the breakdown product of fat. And the brain loves fat because the brain is 60% fat and the fattiest organ in your body, which is why high-fat, not low-fat diets may be the best diets for brain health. Number 2, exercise, and I can't help but to continue to emphasize this. Regular physical activity can help improve blood flow to the brain and stimulate the growth of new brain cells. Right, that's right, new brain cells, and I don't know anybody who doesn't want more brain cells if they can get it. Number 3, supplementation with high-quality omega-3 fatty acids is another beneficial effect for your brain. Omega-3s are essential for brain function and can help reduce inflammation in the brain. Additionally, supplementing with MCT oil or ketone salts can help support ketosis and provide the brain with a direct source of energy. But this is not nearly as important as it is for those who are on a keto or carnivore diet. It's really about the diet, guys. MCT oil and ketone salts are particularly useful, though, for people who are thinner, where too much weight loss via keto could put them at risk for losing too much weight. Number 4, guys, ask your doctor or advanced practice clinician about meds that may increase your risk for dementia. Some of the categories include antihistamines, beta blockers, of course statins, proton pump inhibitors, steroids, and antidepressants, but there's more. Number 5 you're looking for more resources, I'm sure, to help you along your way. And I'll start with Dr. Georgia Ede's book, Change Your Diet, Change Your Mind. This book offers valuable insights into the connection between diet and brain health. Certified nurse specialist Amy Berger's book, The Alzheimer's Antidote, which is another great resource for helping us understand how diet can impact our cognitive function. Both of these wonderful clinicians were interviewed on my Protecting Your Nest podcast, so I'll make sure that you'll have a link to those interviews in the video comments and the video notes. Now lastly, I recommend checking out board-certified geropsychologist Dr. Natalie Edmonds' YouTube channel called Careblazers. Dr. Edmonds offers valuable information and tips on caring for individuals with dementia through the lens of a caregiver, giving valuable tips that most clinicians can't give because they have not lived with someone with dementia like my wife and I. So by following these tips and utilizing these resources, you can start your path to either preventing dementia or healing from dementia, and of course improving your overall brain health. Remember, it's never too late to make positive changes for your brain's health, and even those with advanced dementia may still benefit from these approaches. I hope this video helped to restore hope to anyone who's concerned about the important topic of cognitive decline. Again, a topic we've all been talking about lately, and I really appreciate you guys for coming to this channel. I encourage you to share this video with anyone who needs to hear this message of healing. And until another video from the Metabolic Health Doc, continue to be safe, be well, and continue to protect your nest.